And on the line with us is Dr. Bob Gill. He's a family physician in the United Kingdom and a documentary filmmaker. His new film is The Great NHS. In Britain, that's called the National Health Service. The Great NHS Heist Sell-Off. The website is thegreatnhsheist.com for the film. And the National Health Action Party that's fighting to save the NHS is the website is nhap.org. You can tweet Dr. Gill at DRBOBGILL, as in Dr. Bob Gill. Dr. Gill, welcome to the program.
Thank you, Tom. Thank you for having me on.
Thanks for being with us. So to start at the beginning, most Americans are not familiar with the differences between the British National Health Service and some of the other European single-payer systems, or the hybrid systems, or system that they have in Switzerland, or is certainly, how it is here in the United States. You want to give us a 1 or 2 minute summary of what the NHS is and does?
Well, the NHS, when it was set up in 1948, was designed as a very simple structure which was funded through taxation and delivered by doctors and nurses employed by the taxpayer. So everything was funded by taxation and provided through hospitals which were owned by the public and delivered by public servants. A very simple system.
Right, and this is what you would call socialized medicine, as opposed to single payer, where you've socialized the payment system, but you can privatize the doctors and hospitals and things like that, correct?
Yeah, socialized system. The systems in Europe are a little bit of a hybrid, where you've got private providers and some private insurers. But the NHS, when it was developed in 1948, was a pure public service.
Right. And in the years since then, what has happened, and what is this? What is the Great Heist? Tell us about your movie, your documentary.
Well, essentially what's been going on over the last 2 decades has been a very complex and stealth deception. And this has been carried out by consecutive governments. The main factor about this heist is that most people don't know it's taking place. Now, that is critical to the success of the heist, to make sure that the doctors, the nurses, the patients, the public, the taxpayers do not realize that their precious and respected health system is being systematically converted and prepared for an insurance industry takeover, and the people taking it over are going to be American health insurers like United Health, Kaiser Permanente. These organizations are behind the scenes setting the system up for their takeover.
Whoa. That's amazing. So at the same time that the United States has a strong pressure to basically scale back, if not destroy, some of these, I call them banksters, because they don't actually cure anybody of any illness or diagnose or give vaccines or anything. They just handle money. These so-called health insurance companies, they're trying to go worldwide. They're trying to go into the UK. I'm surprised this actually didn't start under Maggie Thatcher, or did it?
It did start under Maggie Thatcher. In fact, the plans were written in the 1980s. There was a report by the Adam Smith Institute called The Health of Nations, which outlined how to get from a socialized system to an insurance system. Another paper in 1988, written by Oliver Letwin, who was employed by N.M. Rothschild's privatization unit. He produced a paper called Britain's Biggest Enterprise, which again set out how to go by stepwise sequential progress to an insurance-based system. Now we have at the head of the NHS, now you might not believe this, a guy called Simon Stevens. Now Simon Stevens was president of United Health's global division, and he spent 10 years at United Health as a senior executive, and he's running the show.
Wow. And United Healthcare, this is the company that Stephen J. Hemsley is the CEO of, who has taken over $1 billion in compensation. His predecessor, who is referred to as Dollar Bill McGuire, took over $1.6 billion of compensation, got busted for fraud, had to give back a couple $100 million, or busted for some sort of impropriety. This is a company that is, at least among people who know anything about it in the United States, very controversial. On the other hand, they basically own the Medicare Advantage market in the United States, because their front group, the AARP, the American Association of Retired Persons, gets most of their revenue from selling these so-called Medicare Advantage programs which take people out of the Medicare program and put them into, you know, a privatized system that sort of looks like Medicare. People think they still have Medicare. These people really know what they're doing. They know how to game the system and how to fool people. How are they doing it in the UK?
Well, they've basically bought our politicians. They certainly dominate the media narrative. Most of the public, indeed most of the professionals who work in our health system, haven't got a clue. And that's the purpose of our film, it's a real desperate wake-up call. And that's why we're producing this film. We've got a GoFundMe site, GoFundMe, The Great NHS Heist. And we're trying to get the message out there loud and clear that despite all the disinformation that we are subjected to, our health service is on the brink of complete corporate takeover. You mentioned United Health. We've been over in the States. We've interviewed people like Wendell Potter. We've interviewed the founders of the Physicians for a National Health Program, Doctors Woolhandler and Himmelstein, and we've learned how fraud is endemic in the private system. The insurers will always be one step ahead of the legislation. In fact, oftentimes the revolving door ensures that the insurers themselves write the policy for government. We know that Simon Stevens, the name I mentioned earlier, before he came back to the NHS, he actively campaigned against the public option in Obamacare, and he also campaigned for the inclusion of healthcare into TTIP, the trade deal that's been abandoned recently. It's
amazing. It's like anything that can be done good by government, if you can get government out of the way, it presents an opportunity for billionaires to make more money, skimming it off the top of the public. How is the NHS doing, by the way, in Great Britain?
The NHS is now in the phase of defunding. A famous quote from Noam Chomsky talked about defunding prior to handing it over to private capital. So we're in the phase of gradual restriction of funding. The service is being made to look bad. There are bad headlines in the papers all the time, on the media. Public confidence is being deliberately eroded. The health professionals don't have the resources to do a good job, so they're losing faith in the system. So you have this very cleverly thought out propaganda tactics, funding squeeze, and the solution will be let's ask our American friends to help us out.
They're doing the exact same thing here. The strategy was laid out during the Reagan administration. David Stockman coined the phrase "starve the beast." He wrote a book later apologizing for it. But basically, you look at a system that is working well, Social Security, Medicare, something like that. You look at a government program that's working well. You dial back its funding to the point where it's no longer working well, where there are long wait times, people are frustrated on the telephone, et cetera, et cetera. It's happened with the IRS, for that matter. You damage the program, and then you point at it and say, look, the program's damaged. We have a solution. Let's turn it over to, billionaire A or billionaire B.
That's exactly the formula they use. It's very successful. They're using it again. But fundamentally, what we have is a horde of parasites who we don't need to run a health system. You don't need insurers. You don't need managers to the extent that we're getting them now. I understand in the American system from the 1970s to the present day, the increase in management and administration went up 30-fold in the health system. In that same time, the increase in health professionals only went up 2-fold. And we've had that same disease being infesting the NHS. So we do know that that's how it works. They have to make it look bad. They have to restrict the funding. And we know that when you have the profit motive in healthcare, it doesn't work like any other market. You have what's called information asymmetry, where the patient is not a consumer because he doesn't have the full information. Right. And you also have something called provider-led demand, whereby you have a perverse incentive for the providers to overcharge you, to overdiagnose, to overmedicate. And we know that leads to patient harm. So we're on a trajectory to be spending a lot more money, either directly through taxation or directly out of our pocket. The total cost will more than double. The healthcare will get worse. And our public just aren't aware of this. Amazing.
Dr. Bob Gill, family physician in the United Kingdom, documentary filmmaker, The Great NHS Heist sell-off, the website, thegreatnhsheist.com, and you have your GoFundMe page again is?
It's GoFundMe, and it's The Great NHS Heist.
Good. Very straightforward. Dr. Gill, I wish you the very best.
Thank you very much.
Thank you so much for being with us today. We'll be back.